Hey guys, what's going on? Welcome back to another video. I want to talk about my neck issues here and what the steps were that I've taken since my last video, which is my last video. Clearly, I was going to the chiropractor. I haven't been to the chiropractor since, wow, I don't even know when's the last time I went. I want to say maybe March or so, like beginning of March or end of February. There was improvements, and I was going there, but I was going a lot, and I was really going a lot, and I wasn't sure if it was helping or hurting me. However, I did want to say there were some improvements going to the chiropractor, but flat out, chiropractor had told me right off the bat that I would basically be going there for life, and it's not something that they'd be able to help me with. They wouldn't be able to get me back to 100%. They wouldn't even be able to tell me how far they'd be able to get me at. I eventually got to a point where I asked the chiropractor, look, this is still going on. I don't know what's wrong. I haven't been to MRI since 2014. Can we go ahead and get a new MRI? And they did it. They did it. I went to MRI. I was struggling in the MRI, to be honest with you. I was struggling in the MRI. So that is the one thing that really bothered me a little bit more, was the struggle with the MRI. Because for whatever reason, it was like my muscles were twitching in certain areas and stuff like that. And I don't know what was causing muscle twitches, but it was kind of strange. It was like 15 minutes long. The MRI was very easy because it was only 15 minutes long. So it was like, just basically 5-minute prep, 15 minutes, and get the heck out of there. But it's still, I don't like going to MRIs, and I'm gonna see if I can try to avoid going to any more MRIs. But I did get my MRI from these folks, and I want to do a comparison with my old MRI and my new MRI, just to give you guys an idea of where it's at. So my old MRI from 2014 was from an orthopedic doctor that didn't really specialize in anything neck issue, but C3, C4, broad-based disc herniation with significant cord impingement, right? So that's what they were saying as C3, C4 level back then. C3, C4 level here has now said posterior disc osteoid complex that flattens vertical thecal sac that is bilateral facet hypertrophy, mild spinal canal stenosis. There is moderate bilateral neuroforaminal narrowing. Basically, it means that it's like a bulgous or a herniated disc at that point. But it didn't talk about the significant cord impingement on here. But it did talk about mild spinal canal stenosis. So that did improve a little bit there. This one did have the previous one didn't have C2, C3. This one did have C2, C3. And the C2, C3 says small broad-based posterior disc osteoid complex, no spinal canal stenosis or neuroforaminal narrowing. So it's got no stenosis, no bulging disc, nothing like that. C4, 5, last time, this bulge without significant stenosis, very mild stenosis. C4, 5, there's posterior disc osteophyte complex flattening, the ventral thecal sac. There is left-sided unconvergible hypertrophy. There is mild spinal canal stenosis, mild left neuroforaminal narrowing. So basically mild spinal canal stenosis, spinal stenosis, and then a very mild disc bulge as well. C5-6 is where we started seeing more problems here. C5-6 disc bulge resulting in cord compression. So it's not even cord impingement, it's cord compression. And bilateral C6 root impingement. C5-6 says now the posterior disc osteoid complex flattening the ventral thecal sac. There's bilateral unconvertible hypertrophy, moderate spinal canal stenosis, so moderate stenosis. There is moderate bilateral neuroforaminal narrowing as well. So it's telling me it's got a moderate disc bulge there as well. C6-7, last time, it says central disc herniation resulting in significant cord impingement. So it does say significant cord impingement, again, on that one as well. So there's, we're having cord compression and significant cord impingement on the level below. Actually, there's a couple of levels above that has significant cord impingement, but didn't really say that on this one. It didn't say anything about it. But C6-7 here Says posterior disc ossified complex flattening of ventral thecal sac with severe spinal canal stenosis. So severe stenosis. There's bilateral unconvertible hypertrophy with severe bilateral neuroformation narrowing. So severe stenosis, severe disc bulge, or herniated disc, whatever you want to call it. Essentially, they're supposedly the same thing. C7T1, no disc disease, spinal stenosis, or formula stenosis. So didn't even, but that's good. I did like to see that. So impression, degenerate changes worse as C5, 6, and C6, 7. So that is what the impression was here. So that being said, yeah, I went back 1 or 2 more times with things, and you know, and she went over the MRI with me, and you know, she said, you know, look, if this doesn't, you know, if this chiropractic treatment that I'm doing you doesn't help you, you're gonna have to try the chair that I couldn't even sit in, to see if that's gonna help you, and if that can't help you, then we're gonna have to do, you know, send you for a neurosurgery consultation. So I went back 1 time, I went back 2 times. And then after that, I said, you know what, I'm going to go back and I'm going to go do my own neurosurgery consultation, because I found a neurosurgeon that is in network with my insurance. And I'm going to take this to him and see what he says. So I did do that. And I went to the neurosurgeon first. And it wasn't too far, maybe like 10, 15 minutes down the road from me. Very, very close office, very clean office, you know, and asked him some questions about this, and he basically said he diagnosed me with cervical myelopathy. So what's cervical myelopathy mean is that your spinal cord is getting compressed to the point that your arms and legs are actually getting weaker. So he diagnosed it as the start of it. Thankfully, only the start of it. So he, you know, came back, and at the time he said, what I would have to do is I would have to go ahead and replace 2 discs, whether we do it with artificial disc or whether we do it with artificial disc either way. But you know, we don't know what kind of disc, but it could be, you know, like a bone, you know, taken from cadavers and stuff like that. So and then he said, you know, we cut you from the front, put that in there, and then send you on your way. And you know, he really didn't go over too much with me because I didn't have too many questions. So I set up a follow-up appointment anyway. Just to get there, because it's in the back of my mind now that, you know, I asked him, do I need the surgery? What would you do? And he says, well, you don't need the surgery. He says that's the thing. This is more of a, you can wait it out 6 to 12 months and see if things progressively get worse. If they get worse, you know, then yeah, I'd recommend the surgery to you. However, if they don't get worse, if what you're doing with at-home exercise and chiropractic treatment and lots of rest, you know, keep you where you're at, or maybe even improve you a little bit, then, you know, you can put off surgery for 6 to 12 months. He says that's kind of the direction I would go at this point, is what he told me. So I, you know, have it in my head that surgery is now an option on the table for me. And I say an option on the table for me. So I had another follow-up appointment with him actually just yesterday, where I had a lot of questions for him. So, you know, again, went over the condition with him. He told me exactly what it was. It's due to degenerative changes in you know, in here and in my neck. And he did say that the 2 levels, the C5, 6, and C6, 7, are the 2 that are the most affected. Those are the ones that could potentially be causing me the most problems. However, he did say that the 2 levels above are also potentially causing me problems too, but they're very mild. So he wouldn't even bother touching them right now, but it's a possibility down the road he might have to. However, so I asked him about the surgery again, and he explained it to me. However, the way he explained it to me was that he said it was just basically a 2-level fusion, which I was a little surprised about. But I'm not sure if I caught what he was trying to say, because I thought he was telling me that discs have to get replaced and they have to get fused, and that's it, but it's only at 2 levels. I'm not sure. I got to go back and ask him, because I'm not 100% sure on that. But the reason for any of that is because of how bad it is over there. You know, it's really bad. It's affecting my day-to-day life. And he knows that. I know that. I asked him if it's considered minimally invasive surgery. He did say to him, yes, it is. So I asked him if is the surgery considered a fix or just to slow the progress. He says that that's a really good question. And you know, I asked him, would it resolve my symptoms? He says he's not sure if it would actually resolve all the symptoms, but he did say that it would make me about 80% better than where I am today. So that's a positive I think I took out of this. I asked him what the success rate is of the surgery, what his success rate is of the surgery, how many of these surgeries that he does per year. He explained to me that he does a little over 100 of these surgeries a year. His success rate, he would rate it at 100% because no one's ever had a failed surgery and no one's ever had to come back to him with any big problems or anything like that. So that's good. I was happy to hear that that he did say that. Uh, the one thing I just wasn't sure about the success rate of the surgery, but it sounded like what he was saying is that it's a very successful surgery and it's a very easy surgery. At least it would be an easy surgery on me. Okay, so that's good. I asked him, is his condition permanent or can it get better? He says that with the current environment that we're going through today, with the coronavirus and everything else that's happening, it's a possibility that I could get a little better, especially if I'm not doing anything. Like if I'm not 100% active and I stay put and just sit down, lie down, do whatever I need to do, it could get better over time. However, the condition is really permanent, and that's just how it is. There's no doubt about that. But with surgery, it will at least resolve a lot of the issues, and it may not be 100% permanent at that point. I asked him what alternatives I had. Because I've been through physical therapy, I've been through chiropractic work, I've been through at-home exercises, I've been reducing everything I've been doing. I've even reduced my driving. Like that's the biggest thing that's killing me the most. Like I'm like, oh, well, I'll get to that in a minute. But that's the thing that's killing me the most because I want to get out and I want to do things, and I want to go places. But I'll get to the driving piece in a bit. But I asked him about what alternatives they have, and he basically said, I basically presented you with the alternative of waiting it out 6 to 12 months and see how it gets. The other alternative is instead of him cutting at the front of the neck, he could potentially cut at the back of the neck and do it from there. However, he said that was much more difficult to do that way, and it would be more difficult on him. I asked him, how long is the recovery and what does the recovery involve? The recovery does involve. Let me explain a little bit more because there's a little bit more on this. It might answer some of the questions that I did ask already, and I'll try to put them all into one. The recovery does involve wearing a cervical collar for potentially 2 months. So give or take 8 weeks. Let's just say 8 weeks. It could be less than that. Definitely could be less than that. I know some people do 4 to 6 weeks. It also has I guess a bone graft stimulator or whatever the heck it is, where I would have to use it, I think, from 4 to 6 hours a day or something like that, just to help. I think he said 4 to 6 hours a day. I'm not 100% sure, but just to just to make it easier and just to heal me up quicker and blah blah blah. So that's kind of important to note that, because I think that's going to be something that I would have to really get used to. Cervical collar probably won't bother me too much because I've been wearing all these several weird devices anyway, with a cervical collar or hard collar. Hard collar might be a little bit more difficult on me, but when I asked him about, how long recovery takes, and he says, here's how you're going to feel. For the first 2 months, you might feel like someone beat you up. He goes, that's what it might feel like. You might feel like somebody really beat you up. He goes, but I don't know. He goes, yeah, I really don't know. So it might be like that for the first 2 months. After those first 2 months, you're gonna start feeling start feeling good. And then 6 months down the road, you're gonna feel great. And 12 months down the road, you should be fully healed at that point. That's what he told me. Now, what he did tell me as well is that it's possible that depending on my healing, it could be I could feel good after 2 weeks. That's a possibility. I could be feeling good after 2 weeks. And maybe not perfect, but better than what I feel now. So that's good. I asked him what hospital surgery is done in and how long is a stay, whether it's inpatient, outpatient, blah blah blah. He gave me a list of 3 hospitals, one that he was more comfortable in, but I'm not sure if I'm going to choose that one because it's like literally in the middle of the ghetto. But unfortunately, it's the one that he's most comfortable with, but it's not that close to me. There are 2 that are closer to me that I could choose. One's a little bit more fancier. One's a little bit more, it's kind of not far out there, but it's kind of like in the middle of nowhere. Um, so that could potentially be the other place that we do. So I don't know, but the stay, he said that typically something like this, they would release me the same day. However, what could potentially happen is that they might opt to keep me overnight just for that one extra day stay. So I don't know how that's gonna go. I asked him how long surgery takes, and I joked with him. I said, no, for me, it might just feel like 5 minutes. I fell asleep, and then I woke up, and that's it. And he said that's exactly how it's gonna feel. He did say though, but for him, it's gonna take him about an hour and a half. One thing that didn't make me feel too comfortable was I asked him who's going to assist him in his surgery because I figured it would be a team of neurosurgeons. And he said it's going to be him and a physician's assistant, and that's it. Um, I don't know how I feel about that. I mean, I would think that you would need a full team, but if he's doing over 100 of these surgeries a year and he's got a 100% success rate on them, at least is what he's telling me, yeah, then I might, might be okay with it if that's what he's doing. How long before I can get back to driving and all other normal activities, actively like in hockey, yoga, hiking, all that stuff. He flat out told me that driving wise, about 2 weeks. Give it about 2 weeks. He says as long as you can go like this, which that bothers me when I do like that. As long as you go like this and you can turn your head and you can look around and do all the stuff that you need to do. And by the way, that's kind of tough to do right now. He says that would be the ideal thing that would be ideal, and I can go back to driving within like 2 weeks. Now granted, he said don't go crazy driving. He says I wouldn't drive more than an hour at a time. He said to ease it, and you got to ease yourself into it. So like maybe do a few minutes here and there, and then see how you feel. Then go up to the hour, and then once the hour's up, then gradually go into it. And after a few months, you can say, oh, I can take a 5-hour drive, But he says obviously don't go crazy and go into a 5-hour drive right away if you don't have to. If you just need to drive an hour somewhere, that's fine. Just do that, and that's fine. And if you have to drive an hour back, you should be okay with that too. So I thought that was good that I at least got that question answered. The other question that I had is that can I have full range of motion with a movement with my neck after surgery? He said it will be limited. He didn't deny that. He said, however, he says you're limited right now with what you can do. And looking looking right, looking left, right, that hurts actually right there when I'm doing that. And I've noted that when I'm driving, that's even worse. Because that is one thing, if I come to a stoplight and I'm trying to look left or right or anything like that, it's literally a struggle. Like it's like I feel like my head's just gonna go, and that's it, or my neck's just gonna explode or something like that. He said your range of movement and everything will actually probably be better than what you have right now. Which I was happy to hear that. He says probably better, and you'll have a lot less pain and a lot less weakness from the neck coming from there. So that's important for me because I think that's going to be something that's going to think about that. How much does insurance cover and what is the out-of-pocket cost? He didn't know. He didn't really know. He said basically call the billing department, try to find out, because your insurance, they are in network with my insurance, so your insurance will cover a decent amount of it. There might not be a lot of out-of-pocket costs, and that's it. Now I'm looking up the surgeries, and depending on what he does, it could be anywhere from $3,000, $8,000. I don't know, out of pocket. I gotta look at that. Do I have that money right now? Oof. Yeah, not really, but I mean, I'll make it work somehow. That's just how I usually do. I try to make things work. Do I risk paralysis with this surgery? That was one of my questions. He flat out says that the surgery does have less than an 8% risk of paralysis. He says less than 8%, which means that it would pretty much be 92-93% success rate for the surgery. So that's good. He says honestly, because the way my neck is today, I'm at more risk for paralysis if something should go wrong, if I should get into an accident, if I should have a bad fall or anything like that, or if I should just let this go too long, I'm at more risk for paralysis than I am with the surgery. Without the surgery, I'm at more risk for paralysis because it's compressing my spinal cord, and that's something that I need to address. Okay, fair enough. I asked him if there's gonna be any damage to vocal cords surgery. He says sometimes it does happen. He says they try to avoid that though. That they go to the front. They try to move the muscles around. They try not to do anything bad. He said that they try to avoid anything like that. Most people that I know that have had the surgery have had no vocal cord problems. I know a few folks that I know some of you personally have had neck surgery, and you've never had a major issue with vocal cords. So, and mostly everyone I talked to that's had neck surgeries have had good things to say about it, saying that it's really helped them tremendously. I asked him, how do I start the procedure or how do I schedule a surgery? He said I could basically call tomorrow, call this office and say, I want to get this done. However, I did ask him how long do I have to decide if I want to proceed with the surgery. He said that I really have to August to really decide right now. However, with the way things are today, with the whole coronavirus thing going on and a lot of the hospitals being booked up, he would not be able to get me into some hospitals right now unless it became more severe. That's the only thing. It's the only way to be able to get into a hospital right now. And then at that point, he'd be able to make a case and get me in almost immediately. So he basically said that right now he wouldn't be able to get me in, though a month or two from now he probably could. He's just going to have to take some time, and he's got to worry about that. He says that if I wait till August, then I'm definitely going to have to go get another MRI. It shouldn't be a problem because they've already had one, and it's already showed as severe, so on and so on. Okay, I asked him if there's any medications that I need to take because this is important to me because I got a liver condition, and that is something that if I had to take medications, I don't know how it's going to affect the liver. I actually got to talk to my liver doctor about this to see if getting this surgery is something that will be okay for me on my liver. The doctor flat out said that there's no medications needed, and I asked him about painkillers, and he said, no, you probably won't need that. You'll be wearing that bone graft, and that's gonna the bone stimulator, and that's actually gonna help with the pain a lot. He said that that is the one thing that they're gonna give. So that's the good news. I was happy about that. Now I don't know. I mean, a lot of people are talking about they get on pain meds because they have to, and it's a possibility that I might have to. I could probably try to get through it without it, or just try to get through it with anything. But he basically said, don't take any anti-inflammatory stuff. So stuff like fish oil is out of the question. Stuff like what was I going to say? Motrin would definitely not be something I could take, but maybe like Tylenol might be okay because it's not necessarily an anti-inflammatory, because it would actually slow the healing process, and he doesn't want to see the healing process get slowed down. Okay. But I asked him about medications as well, and he says, well, I see what you're on, and with your medications and my vitamins as well. And he said, so you got to be careful because now you got to talk to your doctor to see if that's going to affect you at all. So hence why I got to go talk to my doctor. I still have some questions for him regarding the procedure. Want to understand exactly what it is and exactly what's happening. I really, really don't know what to think about that procedure anymore. I mean, I've been watching some videos, most of the on YouTube and stuff like that, and people have had success with this procedure. Great. I've talked to friends that had neck surgeries, and they've had a lot of success as well. Great. I don't know how much longer I can continue going on with this. I mean, my friends have seen me struggle for 6, 7, maybe even 8 years at this point with this. About 7 years, about 6 or 7 years. And all of them are saying, just get this addressed, just get this out of the way, get this done, and that's it. So what am I doing? Am I leaning towards it? Yes, I'm leaning towards it a little bit more. Obviously, just waiting and doing nothing is not going to help. Just might keep me where I'm at today. However, if I do this and I address this, it might make me better, and then I can get back to a normal life, or at least a somewhat normal life. Things are probably going to have to take a little bit of a back burner for me. Like, for example, playing hockey is probably going to have to maybe be pushed back. And you know, that's not the worst thing. We really haven't been playing anyway. That might be the first thing that I'm gonna have to do, but you know, not going crazy or doing crazy things. And after 2 months, easing myself out into lighter exercises and seeing how things go and blah blah blah. So I'm leaning towards it right now. I've talked to a few people on social media. I've talked to a few friends. I've watched enough YouTube videos for people that had this procedure, and everyone's saying that it's, you know, it's worth it to just do it and to see, you know, and you should improve. But yeah, I mean, I guess the biggest question is what the procedure actually is, because there was a little bit of confusion there about how he was going about that. You know, was it an actual disc replacement with fusion, or was it just a fusion now? And I don't really understand what he's trying to tell me. So there's my update for you. For you guys, I know a lot of you guys are quarantined at home, just like I am right now. You know, or at least you're supposed to be quarantined at home. Maybe you're getting out just to get food or do whatever. You know, feel free to drop me a line. You know, just if you want a video chat or anything like that, or if you want to just talk or just message me or anything like that. You guys know how to reach me. You can do this. If you're watching this on YouTube, you're more than welcome to message me on YouTube. If you're watching this on my social media accounts, you are more than welcome to also do this, you know, to really get this through on my social media account as well. You know, and just reach through me, just reach me through me on there, and you know, message me or whatever you want to do. That's it. I mean, there's really nothing else to this. So I'll update you guys once I make a decision on what I want to be doing. Thankfully today has been a better day. As you see, I'm not wearing any neck collar or anything like that. Neck felt a little bit better. When I waking up this morning. Got better as the day got along. So I'm hoping that whatever I have, see if I go like this, I'm okay. You know, was trying to do that. That's when things are really tight, and that's when things are really tight. And that was the other thing I wanted to ask him is, you know, why he wasn't. Why he wasn't doing all 4 levels instead of just the 2. So yeah, that's it. Nothing too crazy. So feel free to reach out to me, and you know, and hopefully I'll have a better update for you guys soon. And maybe we'll see maybe we'll see what happens in the next video. You know, maybe it'll be a miracle. I don't know. We'll find out soon enough. But obviously I've been with this for too long to just keep this going. So I'll see you guys in the next video, I think.